Hi guys, Dr. Liz here. I'm a psychiatric nurse practitioner with a doctorate's degree, and I am coming at you with informational tidbits about psychiatric care for your family and you. So today we are talking about why we treat ADHD, like why the heck are we so into diagnosing and treating ADHD as early as possible. So the first thing we're going to do is review what ADHD even is. So it's attention deficit hyperactivity disorder. Back in the day, we had ADHD and we had ADD. And ADD was you could sit still fine, you just couldn't focus. ADHD was you couldn't sit still. Okay, we got rid of both of those and we just turned it into ADHD with a specifier. That means that there are 3 different types of ADHD. There's ADHD inattentive type, which is where you cannot focus, it is very hard, but you can sit still. ADHD hyperactive type, which means that you cannot sit still, but you can for the most part focus. And ADHD combined type, which means that you have difficulty focusing and sitting still. Regardless of the type of ADHD, they all tend to start in early childhood, usually around age 3, although we don't usually diagnose or treat until the child is school age. ADHD tends to be highly genetic, which means that if mom or dad has ADHD, there's about a 75-ish% chance that child will also have ADHD. ADHD is more prevalent in boys than in girls. We don't know exactly what causes it. So there's still a lot of research being done. One of the bigger theories is that there's something not quite right with the prefrontal cortex of the brain, and a neurotransmitter called dopamine is not moving correctly in that area. But again, we don't know for sure. We do know, however, that ADHD is not caused by food additives or food dyes / colorings or sugar. Okay? We also know that in about 60% of children, ADHD does not remit. That means that 60% of kids are going to go on to have ADHD even into adulthood. ADHD is considered a chronic illness, so you have it for the lifespan. Okay? However, ADHD in adulthood does tend to look different than it does in childhood. So when we are adults, we tend to be a little bit more emotionally mature, emotionally developed. And so as children, we can be very hyperactive and inattentive and impulsive with our ADHD. But as we grow up, we just kind of learn like, you can't get up from your work desk in the middle of the day, like you'll get fired for that. And then you can't really wander over to your coworker and touch them. You can go to jail for that, okay? So, and we have that emotional maturity where we can be like, okay, I'm gonna resist the urge to do that. But we still do struggle with the inattention and some of that impulsivity in adulthood. So my ADHD adults, they have trouble with spending a little too much money, getting distracted at work. They can also be quite accident prone because of that impulsivity from the ADHD. So they can still get into like a lot of car accidents, more so than we would expect. So that kind of brings me into the consequences of untreated ADHD. To answer our question of why is treating ADHD so important? Unfortunately, ADHD is an illness where it can have some pretty nasty consequences if we don't address it. So with kids, untreated ADHD can potentially lead to issues with school. So the child has a lot of trouble completing their schoolwork, remembering to turn in homework. They start to fall behind their peers and they have a really hard time catching back up. Also socially, they start to struggle. So they don't mean to be annoying, but ADHD kiddos are just loud. They can be disruptive. They touch the other kids a little too much, and other children don't like that. They find that to be annoying or irritating. And so our ADHD kids can have trouble making friends. They can also have some trouble with the teachers. Again, they're not trying to be disruptive in the classroom, but because of their ADHD, they tend to have disruptive behaviors. And that can make it so that the teachers get frustrated and the child starts to feel like something's wrong with them. And they'll start to make statements like, why does nobody like me? What's wrong with me? I'm dumb. And they're not, but they start to feel like that. They start to develop that low self-esteem and that low self-confidence, which in turn can lead to clinical anxiety and clinical depression, which we do not want to happen. Okay. Also, my little ADHD kiddos tend to be very accident prone, and that's part of that impulsivity from ADHD. So, for example, they know, you have taught them that we do not run out into a street. There are cars in the street. Cars can hit you and they can hurt you. But a child with ADHD, they're impulsive. They don't quite have the ability to stop and think. And so let's say they see, I don't know, like a red balloon across the street and they're like, yeah, pretty balloon, I want it. They don't stop and be like, oh wait, mom and dad told me not to run across the street. They'll just run and a car could hit them. Or they'll be like climbing on the monkey bars and they're just like, I'm gonna fly like Superman, even though they know they're way up high. And so they'll fall and they'll break their arm. Okay, so again, lots of accidents or injuries with our little ones, and that can be dangerous. We don't want that to happen to them. With our adults, there are also consequences. So with adults, we tend to have difficulty finding a job or keeping a job. We tend to be put on performance plans because, again, we just struggle at the workplace with paying attention and getting our work done. There's a lot of interpersonal conflict with our coworkers and our friends and even our spouse because our ADHD symptoms can look like irresponsibility or laziness, and that can cause a lot of disagreement and strife with others. The other issue is that we can have that higher incidence of accidents, just like the kids, but for adults, it looks like car accidents, traffic issues, and then that can potentially lead to increased risk of incarceration, so going to jail. Okay. There's still that impulsivity, so spending too much money, racking up our credit card bills, and then also ADHD in adults, when left untreated, increases the likelihood of developing obesity. Now, a big point, a big risk that scares providers, and this is why we harp on everyone to get checked out for ADHD and treat it if it's there, is that ADHD does increase the risk of developing a substance use disorder. And so my parents will bring their kiddos in, and understandably, they're reluctant to start medication. I can understand that because they're scared. And they say, you know, what if my child gets addicted to the medication? I can reassure you that that does not happen. The medication is very, very safe. We would not prescribe it to kids if it was not safe. But again, it's a valid fear. You don't want to do anything that's going to hurt your child. However, the research, and we have lots and lots of research on this, the research says that ADHD medications do not increase the risk of substance use in life, but untreated ADHD does substantially increase the likelihood that a child or adult will start to use substances later on in life. Okay, so that's a really big reason why we want to address ADHD ASAP. So that's all I have for this video. I do want to reassure you that there are lots of treatment options for ADHD. I talk about medication. Medication is technically the gold standard, but that is not the only option. There are lots of other things we can do for ADHD, including therapy. There's even some natural supplements that we can try. All kinds of things. Do not feel like you have to do medication for ADHD. There are other options, okay? It's just important to get treated. If you have ADHD, we want to make sure that we're doing something to address it so that you and your child can be as successful as possible. Please be sure to subscribe. I release new videos every week. If you like this video, please give a thumbs up. And otherwise, I will see you next week. Thank you so much. And I wish your family and you wellness.